Hi, I'm Dr. David Hill, and today we're going to talk about how to drain an ear infection. Now, the first thing we have to do is define ear infection. The ear has different parts, and different parts of the ear may become infected. A swimmer's ear, for example, we call it an otitis externa, is an infection of the outer portions of the ear. The outer portions of the ear start here, enter the hole, and stop at the eardrum. That's the external auditory canal. That's the tunnel from the hole down to the eardrum. That's where otitis externa occurs, and that doesn't usually require drainage. In severe cases of otitis externa, however, the canal gets so swollen that there's no space, and sometimes an ear, nose, and throat specialist will actually need to insert a wick down into that space so that medicine can get in there. But that's not draining, that's the opposite of draining, that's putting something in. Now, the other part of the ear that frequently gets infected is called the middle ear. That starts behind the eardrum, inside the head. That's an air-filled space that contains bones. The bones conduct sound waves from the eardrum into the cochlea, the nerve that actually generates the nerve signals that your brain interprets as sound. That space is infected. It's called an otitis media, or a middle ear infection. Those can be quite painful as pressure builds up against the back of the eardrum. Now, normally it's not necessary to drain these, although sometimes they do drain on their own, spontaneously. A little hole forms in the eardrum, the pus comes out, usually feels better after that. But there are some cases where drainage is required. Now, a few pediatricians know how to accomplish this drainage. More often it's an ear, nose, and throat specialist who knows how to do it. It requires numbing, so there's some numbing drops that are put in for anesthetic, and then the child or adult has to be very still during the procedure. In what's called a tympanostomy, or a tympanotomy rather. In a tympanotomy, you take a tiny little scalpel and just cut a nick in just the right part of the eardrum, and usually we do that because we want to culture the fluid inside the ear to see what sorts of bacteria are causing the infection. This is not done very frequently anymore because we can usually guess what it is, and we have broad spectrum antibiotics that are effective against a lot of different microbes. The more common reason to do that drainage is to insert pressure equalizing tubes, or tympanostomy tubes. These are the ear tubes that you hear about. These are used usually for children who have multiple severe or chronic ear infections, and they provide some relief from these ear infections and some prevention of recurrence. So that's almost always done by an ear, nose, and throat specialist, usually under anesthesia, often in a hospital, but occasionally in an office setting. Talking about how to drain fluid from an ear infection, I'm Dr. David Hill.